Hey there, health warriors. Have you ever heard of a disease that makes you itch like crazy, look like a tomato, and sends parents into a panic? Yep, I'm talking about chickenpox. It may sound funny, but trust me, there's nothing funny about it when you're the one scratching all night. Let's break down exactly what chickenpox is, how it spreads, what it does to the body, how to treat it, and most importantly, how to prevent it. What is chickenpox? Chickenpox, or varicella if you want to sound fancy, is a viral infection caused by the varicella zoster virus, the same sneaky virus that can return later in life as shingles. It's highly contagious, and in the past, almost every child got it before vaccines came into play. These days, it's much rarer, but still around, especially in places where people skip the vaccine. How it spreads. Now, chickenpox doesn't knock on your door and ask for permission, it just spreads. You can catch it by 1. Breathing the same air as someone infected. Yes, it's airborne. 2. Touching the fluid from those itchy blisters. 3. Coming into contact with clothes or bedding that have been contaminated. Here's the scary part. You can be contagious before you even know you're sick, around 1 to 2 days before the rash appears. Symptoms to watch out for. How do you know it's chickenpox? It usually starts with fever, headache, tiredness or fatigue, loss of appetite. Then bam, you start seeing red, itchy spots. These turn into fluid-filled blisters and finally crust over and scab. It usually spreads from the chest and back out to the arms, face, legs, and even inside the mouth or eyelids. How long does it last? From the moment you're exposed, it takes about 10 to 21 days for symptoms to show. Once the rash breaks out, it lasts roughly 5 to 10 days. You're contagious until all those blisters scab over, and yes, you might have more than 500 of them in severe cases. Who's most at risk? Most kids recover without complications, but it's not always mild. Chickenpox can be dangerous for babies, pregnant women, adults who've never had it, people with weak immune systems, like cancer or transplant patients. It can lead to skin infections, pneumonia, brain swelling, encephalitis, and even death in rare cases. And don't forget, the virus never fully leaves your body. It hides out in your nerves and can reactivate later as shingles. That's another whole story. Treatment. So what do you do when chickenpox strikes? Most cases can be managed at home with adequate rest and lots of fluids. Use of calamine lotion or oatmeal baths to calm the itch. Give paracetamol, never aspirin. It's dangerous in chickenpox and can cause Rice syndrome. Keep fingernails short and clean to avoid skin infections from scratching. Wear soft, loose clothes to reduce irritation. Severe cases may need antiviral medication like acyclovir, but this must be prescribed by a doctor. Prevention is power. Now for the real hero of the story, the chickenpox vaccine. It's called the varicella vaccine, and it's incredibly effective. 2 doses are recommended for all children, teens, and adults who never had chickenpox. Vaccinated people are way less likely to get infected, and if they do, symptoms are usually very mild. A few spots, no fever, and no misery. Fast facts. Here's a quick summary we must stick to brain. 1. Chickenpox is a viral infection. 2. Spreads easily through the air or touch. 3. Causes rash, fever, tiredness. 4. Can be mild or very serious. 5. Vaccine equals best protection. 6. Once infected, the virus stays in your body forever. 7. You can get shingles later in life because of it. Bonus tip: what is shingles? Shingles is when that same varicella virus wakes up years later, usually during stress or weakened immunity, and causes a painful rash on one side of the body. Good news, there's a shingles vaccine too, especially for older adults. Have you or someone you know had chickenpox? Let me know in the comments below, and if you found this video helpful, smash that like button, subscribe, and hit the bell so you never miss a new video on staying healthy and informed. Thanks for watching, and remember, prevention is better than the itch.